Afternoon, everyone. My name is Derek Coy, and I'm a Senior Program Officer here at the NYHealth Foundation. I'd like to first start off by thanking you all for joining us today for this incredibly important conversation about transforming efforts to prevent firearm suicide in the veteran community. I know your time is precious, so we truly appreciate you tuning in today. I'm also very grateful to have two amazing guests, Dr. Russell Lemle, the former chief psychologist at the San Francisco VA and co-founder of the Veterans Healthcare Policy Institute, as well as Dr. Gabriela Kazanoff, a research associate at the University of Pennsylvania's Perelman School of Medicine, both of which you will hear from shortly. Before we kick things off, I'm at the Foundation's headquarters in New York City, so it is with honor and gratitude that I acknowledge the land itself and the Lenape people who have stewarded it for countless generations before being displaced. Also, a few housekeeping notes for our hearing impaired attendees like me or anyone else in need of live stream captioning. You can click on the closed caption icon at the bottom of your Zoom screen and select the show subtitles and or full transcript options there. In addition to our excellent guests, we also have a great audience joining us today as well. So feel free to send comments and questions into the chat box and share any contact info or resources you like there as well. We'd love to hear from you, and I will try to sneak in any questions that I can. And just a heads up, this webinar is being recorded, so we'll be sure to send out an event recap email with a link to the video that will be sent to everyone in the next few days, so be sure to keep an eye out for that. And finally, without further ado, I'm excited to kick off this conversation. Dr. Lemle, I'd like to start with you by channeling our friend and your colleague at the Veterans Healthcare Policy Institute, the amazing Suzanne Gordon, who has taught me many things. One, the importance of not discussing veteran issues in a vacuum so that we know how they compare to the general population. And in that spirit, before we focus in on how firearm-involved suicide is impacting the veteran community, can you set the stage for this conversation by telling us more about suicide in the U.S. in general, with the focus on the role firearms play in this issue?
Sure thing, Derek, and thanks for inviting me. The raw numbers in 2023 for suicide in the U.S. is over 49,000, and 55% of them are by firearm. Both suicide rates and firearm suicide rates have been rising steadily for 20 years, and so with over half of suicide deaths by firearm, it's really impossible to talk about suicide prevention without talking about firearm suicide prevention. This is a fairly new consideration since accessibility of means used were historically ignored in thinking about suicide prevention. And now we're approaching the issue in the importance of increasing the time required for individuals with suicide intent to access firearms, and so that we can provide a critical window for the impulse to subside.
Excellent. Thank you so much for that. And Dr. Kazanoff, now that we have a better understanding of the larger issue of suicide in the US and the role firearms play, can you tell us more about how the veteran community is impacted by firearm-involved suicide and what the most recent data tell us?
Yeah, I definitely can do that. And thanks for having me as well. Russell mentioned that firearms make up a big portion of suicides among U.S. citizens overall, and that's especially the case with veterans. So the latest numbers show us that 73% of veteran suicides are by firearms, which is a really huge percentage. And this is probably due to the higher access to firearms that veterans have. So about half of veterans own firearms compared to about a third of civilians. And we also know that veterans tend to store their firearms less securely, just based on kind of nationally representative data that we have. And so that higher access and less secure storage probably does a good bit for accounting for the higher rate of firearm suicide among veterans. And then, of course, we all know that veterans just in general have a higher rate of suicide than civilians do, unfortunately, due to a variety of factors, demographic factors, trauma, the access to firearms as well. So, and, anecdotally, veterans often know somebody who's been impacted personally. And so it's a really, it's a topic that's really important, and I think near and dear to veterans' hearts, as you know, Derek.
Yeah, absolutely. And thank you so much for that additional context. It's really helpful to, set the stage and really know the foundation before we get into some of the more specifics. And Dr. Lemle, I remember reading a book a while back titled Lincoln's Melancholy. I'm not sure if you've heard of it, but it focuses on President Lincoln's mental health. And it mentioned that he would often have suicidal ideations, and he chose not to carry a knife with him because he was afraid he might harm himself when having suicidal thoughts, which is a concept that makes sense in theory. But I'm wondering, is there any evidence that shows reducing access to lethal means can prevent suicide? And is there concern that someone in crisis would just find another method to harm themselves if one isn't available?
That's the perfect question. So, the evidence around the efficacy of this comes from several surprising findings. I think first we start with the myth that suicide's inevitable with individuals who have serious intent. I think the evidence says that the intensity of that intention fluctuates. Most people don't remain chronically suicidal. Obviously, some do, but most don't. There's interesting studies of individuals who survive suicide attempts, including serious suicide attempts, in which 2/3 never attempt a second time, which is a bit astonishing to think about somebody who would throw themselves in front of a train and survive. I mean, that's a serious attempt with high lethality, and yet 2/3 of them never even attempt a second time. That tells us something. There are other studies of suicide survivors in which nearly half of them report that it was less than 10 minutes between the actual decision, I'm going to try and kill myself, the decision to do that, and the actual attempt. It's a very short window for nearly half of all individuals who attempt suicide. We also know that reducing access decreases the risk of dying by suicide. So if you look at the way that firearms are stored in individuals' homes, in homes where firearms are more securely stored, you have lower rates of suicide death. And then finally, we have a really fascinating study from the Israeli Defense Forces in 2006. In Israel, many of the members of the Israeli Defense Force go home on weekends. And in 2006, there was a new policy change in which military-issued firearms were required to remain stored on base, and they could not be brought home. And within a year, the suicide death rate declined by 40%.
Interesting. So that's very helpful for a lot of reasons. And I know we discussed this. I'm really excited to have this conversation because, I've been doing this work for quite a bit. And Dr. Kasnov, have you mentioned, it's something that's, impacted me personally. I've lost 3 close friends, military veterans to suicide, one just a few months ago. And it's something that we're very, sadly familiar with. But even to this day, I'm afraid, am I saying the right thing? I know we've gone away from saying commit suicide to die by suicide, but there's still, this concern if I'm saying the right thing, or maybe if, saying the wrong thing, of course. But Dr. Kasnov, as Dr. Lemle points out, that reducing access to high lethal means is often the critical determinant in whether one succumbs to suicide. But when we're discussing reducing access to firearms in particular, I know these can be very tough conversations to have. Like I mentioned, am I saying the right thing? Should I even be saying anything? Am I planting the seed in someone else's mind? And this is especially true for military veterans and our loved ones, which is where I believe resources like Counseling on Access to Lethal Means, or CALM, can be incredibly helpful. So I'm wondering, can you tell us more about CALM and the evolution of that over time?
Yeah, of course. And thank you for those points. And I'm really sorry to hear about that. Um, So as you mentioned, CALM is counseling on access to lethal means. And this was an initiative started around 2005 by Kathy Barber, who works for the Harvard Injury Control Research Center, and the late Elaine Frank, who was at the Dartmouth Injury Center. And CALM was really revolutionary when it started. It was the first initiative to train people to have conversations, both in healthcare contexts and just in general, conversations in daily life, about voluntary and potentially temporary decreases in access to firearms and other lethal means to protect specifically against suicide and self-harm. And what was so revolutionary and different about this was that they pursued a collaborative approach. So they worked with firearm owners as partners, as integral to the process of having these conversations. And they thought it was really important to preserve the individual's autonomy and be respectful and culturally sensitive about firearms. And what they did was teach people to have conversations about their firearm access and their storage practices and their willingness to change their storage practices, especially within the context of suicide risk, and the ability to develop a plan of temporarily limiting access to firearms and other means like medications and other means during periods of higher risk. And this eventually evolved a few years later, so around 2009, to the Gun Shop Project in New Hampshire, which was a collaboration between gun shop owners and other firearm stakeholders, so range owners, instructors, advocacy organizations, together with injury prevention and mental health stakeholders who tried to and successfully got information about suicide prevention to gun shops and to other locations where firearm owners might be, to gun shows, et cetera, to really get the message across of the importance of mean safety for suicide prevention, and the ability for everyone to be able to have these tough conversations when they're appropriate. And this became an initiative that spread across states. So in Washington and Utah, as Russell explains in the paper that that a lot of you will have access to after this conversation. And this way of going about preventing suicide by firearms has spread really, it's now, I think, considered the norm almost. And so lots of other initiatives going on to facilitate offsite storage, to talk about suicide prevention in venues where, people need that information. And so, it was a really influential kind of process.
Thank you so much for that. I think, this topic is very heavy and there's a lot of just bad news for the most part. But I will say it's so encouraging to see, one, that there's this, diverse population that's really trying to work cohesively on one goal, when I think, we're allegedly, very divided these days. A lot of folks would say, I think Pew, asked how folks thought of things politically back in September, and the number one word was divisive. But there's so much that can bring us together. And the idea that this kind of third rail issue, if you will, is one of them. It's very encouraging. So thank you for breaking that down and the info there. Dr. Lemle, your father served in Europe during World War II, and you started working at the VA back in 1981. So you have a very unique perspective on how, the veteran community and services aim to help them have changed over time. So sticking with this theme of evolution, would you mind telling us specifically about VA in particular and their past efforts to prevent firearm involved suicide, as well as your pilot program in San Francisco and the outcomes of those efforts?
Happy to, Derek. Well, before I pivot to that, let me just kind of echo what you and Gabby just said, particularly around the issue of divisiveness. And this is, if there's kind of any single theme in this hour-long presentation here, it is that there's plenty of hope. And I know we can elaborate on that as we go along. But what Gabby described is that the original New Hampshire Gun Shop Project, from which a lot of these efforts stem, grew out of firearm retailers and firearm range owners really being at the origin of these coalitions, from which there have been now kind of across the country spreading coalitions in various states and other places, all kind of predicated on crossing the socio-political divide and working with firearm owners and non-firearm owners alike. So just want to underscore what you said and what Gabby was saying, because it really is at the core of a lot of what we're talking about here. So let me just pivot for one sec, because you're asking really about veterans in particular. And as Gabby said earlier, veterans have 1.5 times the suicide rate of non-veterans. And so it is it's a concern really for all Americans. We've seen over the last 20 years that the rates have been steadily increasing for across the U.S. For suicide and for firearm suicide. And we have these high rates that have remained pretty steady at a high level for veterans. So I think you're right to kind of focus on them. In the VA, efforts at firearm suicide prevention really began in a small way in 2011. There was a very small Kentucky VA-based project in which peer counselors who were going into veterans' homes were trained in CALM. That came and went pretty quickly. And then in 2014 at San Francisco, as you were referencing, I had the opportunity with a VA-funded pilot program to take Kathy Barber's CALM training, adopt it for the veteran population, and then test it out in various VAs. Essentially, that project grew into a 1-hour training that by the year 2020 became mandated really across the entire VA system. So what you have is all 200,000 providers, and these are not just mental health providers. All providers in the VA starting 2020 have to take this lethal means safety training. For mental health providers in the VA, it's a yearly mandated training that they have to retake. So the VA got out way in front of really the rest of the country in terms of requiring that if you're going to be interacting with individuals who are potentially suicidal, that you know how to talk about firearms. And this is also important because back in 2014, when we had the San Francisco pilot, believe it or not, it was pretty uncommon for mental health professionals to get training when they came up through their graduate programs to talk about firearms. So CALM was just coming online, and in the VA, where I just mentioned it ultimately became mandated. This was a pretty uncommon practice. Here we are in 2025, and it is kind of a common practice. If there's still actually a way to go. In the VA, actually, it is very common. And so it's one of the ways the VA really is way out in front of the rest of the country. Just briefly, in terms of some of the other VA efforts, though, that have taken place, is that the VA for the last decade has been offering free consultation to any non-VA provider who wants some help in knowing how to talk about firearm suicide prevention. It is free. It is on the Rocky Mountain VA website that people can contact me if they kind of want to get more. I'm not sure I can kind of slide it in here while I'm talking. The VA has put out guides for fellow veterans in terms of how do you talk to your buddies. VA's sponsored several national conferences, of which there still haven't been that many in the prevention of firearm suicide. And let me just say, in terms of the mandated training, is that although not the only reason about the stat I'm going to give in a moment, is that for veterans who get all of their health care in the VA, and we look at suicide rates of those veterans and we compare them to veterans who get all of their health care in the community care network, for which the VA now is paying veterans to go out into the community. If you contrast those two populations, we have lower suicide rates in the veterans who come only to the VA. Now, whether the training itself is highly responsible for that, we don't have the data on that, but we do know that the rates for VA only veterans, the rates of suicide are lower.
There's a lot there that you said that's remarkable and I think worthy of kind of reiterating. So I really appreciate that. And again, it's like you mentioned, this is not like a cheerful topic. Things aren't, going swimmingly, but there is a lot that is encouraging and gives me hope. And it's good to see that transition and evolution is continuing to happen, because I think folks are learning and kind of figuring out what else can be done to build on the work that folks have done for a few decades now. If I can stick with you a bit longer on this topic, though, Dr. Lemle, you pointed out in the paper that you recently published that was the inspiration for this conversation, which we'll be sure to link to in the comments and the recap email, that healthcare workers have unique advantages and opportunities when providing lethal means safety counseling. You touched on VA in particular, but could you tell us more about what some of those advantages are, even outside of VA?
I'm happy to, and I'm also going to be happy to turn it over to Gabby, who's one of the national experts on this very question. But I'll take the beginning part of it.
Thanks.
The first answer really to your question is that healthcare providers are a frontline opportunity to interact with potentially suicidal individuals. We know from data that 30% of people who die by suicide have a healthcare visit within a week before their attempt. half of them within the preceding month. So just on a numbers basis, there's a lot of opportunity to interact with individuals who are struggling. If there's an established relationship, so this is somebody who's returning to their primary care physician or provider in mental health counseling on a regular basis, those are great opportunities because those relationships tend to have, in most cases, trust built in. And anything that we're talking about today in terms of counseling around access is going to the trustability, the credibility of who's delivering the message is the key component. The other kind of advantage and opportunity for healthcare workers is that, over time, as we were just talking about a couple minutes ago, healthcare workers have gotten training so that they're less afraid to ask. I mean, a decade ago, they were definitely afraid to ask, but at this point, not so much. We know that you can't put an idea in someone's head around suicide that a lot of kind of non-providers, non-clinicians still believe. So there's a hesitation often among friends and family that healthcare providers generally don't share at this point, and it's coming more to be the norm.
Excellent. Thank you so much for that. Yeah, Dr. Kasnov, if you could tell us, start off with a little few of the advantages that healthcare providers have.
Yeah, of course. So as Russell mentioned, healthcare providers have like a real opportunity to talk to patients about firearm security, and whatever concerns may come up. For example, if a provider isn't familiar with firearms or is nervous about having this type of conversation, those are all issues that can be overcome with training, with consultation, with just a willingness to approach these conversations. So, you know, one thing that's like particularly important that we recommend that providers do is contextualize some of these conversations. So, providers might be talking about secure storage for firearms, but they might also be talking about other security measures or other means that a veteran might have access to. And so the veteran wouldn't necessarily feel like they're being called out, or that anything, that the conversation has to focus only on firearms, et cetera. Some other recommendations include like providing rationale for why you're having this conversation and really focusing on the security, the safety of the veteran and of their family members as well. And then, one thing we've learned with research and with a lot of conversations about this is the importance of emphasizing voluntary limits in access. And so the veteran making the choice themselves to recognize when they're having a hard time, to limit their access voluntarily and potentially temporarily as well during periods of higher suicide risk. And there's interesting research on kind of who we consider to be good like messengers for this type of message. And on the one hand, people sometimes note that they want to hear from others who they consider to be experts in firearms. So, you might want to hear about firearms from law enforcement personnel, or from another veteran, or from a gun shop owner or something like that. So those are really powerful conversations as well. But as Russell said, people trust their healthcare providers, and when they're asked specifically if these conversations are acceptable, the vast majority of people, including veterans, say yes. Veterans care a lot about suicide prevention, and they know these conversations are important. And so we see kind of widespread acceptability of having these conversations, particularly when they're approached in a culturally appropriate and sensitive and way in which a provider might be aware of any of the biases that they do have when approaching these conversations.
Yeah, that's super helpful. And I think just, two things that kind of, I think stand out there, just the idea of trust and credibility. That's not novel. Like, I think we would expect that from any person that we're involved with, especially something as serious as suicide prevention. But it's worth reiterating. I think sometimes, especially the audience, I know a lot of folks do this work and we're preaching to the choir, but sometimes the choir needs to, sing a little louder. So it's encouraging to hear that. On the flip side, though, Dr. Kasnov, we know that healthcare providers also have unique challenges as frontline workers. providing lethal means safety counseling. So I'm wondering if you could tell us more about what some of those challenges are. You touched on this a little bit, but in particular, the importance of language, messaging, and having that right messenger for lethal means safety counseling.
Yeah, definitely. Um, so I think one thing that comes up sometimes in these conversations that can be a challenge is, the incorrect, mostly incorrect kind of idea that providers are asking to find out if, a veteran has firearms, that the veteran might lose access to their firearms or might be, part of like some tracking scheme. And so there are concerns that come up in these conversations that providers need to address and provide information to counteract some of those narratives. And the VA, for example, and other organizations have a lot of that information available, right? Summaries of what might happen if you talk about firearms with your provider and the things that tend not to happen to correct some of those misconceptions. And yeah, that, you mentioned before the importance of language, and it's something that I think a lot of us think about. Sometimes it's specific terms, so like a preference for means safety over means restriction, firearms versus guns, but there are also different preferences in different communities, and so important just to kind of ask and get some information on like what is the most acceptable way of approaching some of these conversations and remaining open to that feedback.
Yeah, absolutely. Thank you so much for that. Dr. Lemle, I have another question for you, but is there anything you'd like to add on that about challenges that healthcare workers have?
Yes, I will. I was going to talk about this later, but let me kind of insert here.
Sure.
I mean, Gabby was just talking about the fear that any conversation that some of these veterans have is a fear that there's going to be confiscation just by talking about suicide might lead to confiscation or mentioning that there are firearms at home for somebody, who has suicidal ideation. Um, what's even worse, if you will, in the veteran population, is a lot of veterans won't even go to the VA, period. So that actually they're not having conversations with a provider because there's a widespread myth, and I mean widespread. It's probably a third of veterans, when they're surveyed, have the myth that the VA confiscates a veteran's firearms just if you go and seek mental health care. Um, and so let me disabuse that because VA has never confiscated a single veteran's firearm. And if you go kind of to the other related issue about, well, are those veterans ever reported to the National Background Check System? That never happens for an individual who's seeking health care. There used to be exceptions for that for veterans who are being evaluated for their benefits, their disability benefits, which is entirely different than healthcare seeking. Yeah, and that's gone away. So that actually there is no reporting, except for somebody who is imminently suicidal or homicidal, which was a total of 3 people in the last year uh, who were reported. So um, and yet, as I said, up to a third of veterans believe that myth, and in a National Academy study found that 21% actually won't go to the VA for mental health care or for suicidal ideation out of the fear of gun confiscation. And if we're really going to make a difference in preventing veteran suicide, we have to get individuals who are having mental health struggles for the care and not have them avoid the care out of some myth.
Absolutely. That's super important for a lot of reasons. I appreciate you sharing that. I think also, as you mentioned, the idea that one, I just hate the idea of anyone who needs healthcare not accessing it for any reason. But then two, the idea that we know VA is such a great performer that statistically they're, going to be in better shape in a lot of ways. And denying that access just over a myth, really, not great. But I appreciate you explaining that.
Let me just add, Derek, I
Mhm.
think you were going to drop this in somewhere into the chat, but the National Shooting Sports Foundation, who we're going to talk more about momentarily,
Mhm.
has a 2-page fact sheet on what I just said. It's posted on their website, and I think you're going to put the link to it up sometime.
Absolutely. We'll drop that here in the comments shortly and also have that attached because it's excellent. I'm glad you were able to reference that. But sticking with, one of the themes of the paper I referenced earlier that we linked to was the focus on the unprecedented alliance that has emerged to address firearm suicides in the veteran community. So on that topic, I was surprised to see that a bipartisan coalition of organizations with support from the Trump administration in 2020 achieved something no other White House has done, which is validate the evidence linking firearm access and suicide. And you touched on this a bit when discussing, VA's efforts, but can you tell us more about how other federal agencies and congressional efforts have evolved over time as well?
Yeah, I can. And this is really key to our whole conversation that we're having today, um, which is the notion that if we're really going to make inroads, that recognizing that the messenger is even more important than the message. And I think Gabby hit that point earlier, and it's something that we just have to continually emphasize. You know, and that's for a number of reasons, including that if we're going to reach individuals who are not seeing healthcare providers, then we have to figure out ways that are outside the healthcare system. And that has a lot to do with messengers who have the trust and credibility that you were just referencing again. Um, Before I get to the federal part, let me just go back to something Gabby was saying in terms of state coalitions. It started, of course, in New Hampshire in 2009, as she mentioned, spread to Washington, Utah, and then really to half of the states in the country. Where are these coalitions? And with firearm owners and firearm advocates at the center of them, it increases the whole collaboration that we're talking about. And it's also worth noting, and I don't think we'll get into this here, that many of the individuals from the firearm community who have been integral to these efforts, like yourself, that you just described a few minutes ago, Derek, have been deeply affected by firearm suicide in their own lives, and know kind of the tragic loss, and sort of become motivated to do what you can to prevent any of the future incidents like this, knowing the tragedy that really becomes lifelong for you. And, it is a heartfelt motivation that's driving a lot of this. If we pivot to talk about kind of federal partnerships, you have to start with the National Shooting Sports Foundation's partnership with the VA. And this is a private-public partnership. It was informal in 2013, became more formal in 2019. When it started, it was essentially the distribution of cable locks and some information, but it's grown kind of exponentially since then. At the same time, NSSF partnered with the American Foundation for Suicide Prevention. They co-developed a toolkit that went out to all 10,000 members of NSSF, which is retailers and ranges. NSSF has developed videos, material, other graphics, put that up on their own website. They co-link to the VA's websites and they cross-link. I do want to mention Joe Bartozzi and Bill Broussard. Joe Bartozzi, the CEO and president of NSSF, and Bill, who is the senior communications director. These are two individuals that have been driving forces from within the firearm industry to be collaborating with the federal government in these joint efforts. And that kind of joint effort has kind of been key to kind of why we've had these kind of extraordinary changes. At the annual SHOT Show, which is an annual event in January in Las Vegas that NSSF puts on, it's got 50 to 60,000 attendees at this trade show where all firearm and related paraphernalia and takes over a large section of Las Vegas. At the SHOT Show, the VA's presence is everywhere. They're doing interviews every few hours. There's a suicide prevention booth. Just 2 months ago, there was a 1-hour panel at the SHOT Show right in the middle of the entire event, which was exclusively about firearm suicide prevention, right there in the middle of this national trade show. NSSF and VA have put on roundtables for the last 4 years where they invite key members of the firearm manufacturers and industry. And also want to mention that starting June of last year and then going to run twice yearly forever is something that NSSF developed called the Gun Storage Check Week. This is a reminder to basically everybody in the firearm world to their motto is in terms of make sure it's secure, is the notion that a locked up firearm is going to be safe, not only for suicide, but of course for accidents. as well. But by planting it in National Safety Month and in the National Suicide Prevention Month, it's trying to embed in the public consciousness and firearm owner consciousness that ready access to a firearm in a dark moment can be tragic. Lastly, let me just say that in Congress, 2019, Trump's Secretary of the VA, Robert Wilkie, spoke at a congressional hearing around the fact that the VA is pivoted to make access to firearms something at the center of their suicide prevention efforts. And then the piece that you were talking about in terms of the Prevents Task Force, which was issued 2020 under Trump's administration, and it was a task force that was assembled by President Trump, where there's a kind of key acknowledgement that access is a risk factor for suicide. And as you correctly alluded, that just had never come out of the White House before. And then finally, I just want to say that next Tuesday, there's a bill coming up in the House Veterans Affairs Committee, which is the first firearm suicide prevention bill that has Republican and Democrat sponsors on the bill, and really has support across the sociopolitical divide. So it's got NSSF and it has Brady in Everytown that have been supportive of a bill, and this is really unprecedented if you just think about that.
Absolutely. And I appreciate that breakdown. It's very encouraging. I think really remarkable for a lot of reasons. And I think, Gabby, we're talking about these diverse bipartisan coalitions focused on preventing firearm-involved suicide in the veteran community. And that's something that you've tapped into in your work, helping spread calm, throughout New York. So I'm wondering if you could give us some examples of who are these stakeholders that you've been working with. I assume it'll be kind of the similar folks. But also, why have they been helpful? And are there some folks that you would like to see brought under this umbrella in the future?
Yeah, so our team, including myself, but many others also, so Marian Goodman of the Bronx VA, and Dave Crasta of the University of Rochester, and Gara Lloyd Lester of the Suicide Prevention Center of New York, have been working for a few years with NYHealth funding on both a website that is veteran specific on how to have conversations about lethal means safety and secure storage, and then also on a workshop, which is about an hour-long workshop that's delivered to community members about how to talk to loved ones about firearms and secure storage. And the workshop is co-delivered by a suicide prevention expert and a firearms expert. And the way that we understood the need for this and developed it and pilot tested it was with both county level suicide prevention coalitions and local firearm experts. And so these are gun shop owners and retailers, individuals who are like firearm advocates, and law enforcement personnel, anyone sort of who considers themselves a firearms owner. And it's been really incredible to be able to experience some of those relationships and efforts, over the past few years. We've been mentioning, but just like being able to realize kind of the depth of people's commitment to this particular issue and willingness to sometimes go out on a limb when it's not the most popular thing to talk about or to say, and really bring the resources to their own educational efforts related to firearms, to the SHOT Show, as Russell mentioned, and other retailer kind of events where this information is getting getting more airtime, but still is not as common as we want it to be. And going back to something that we were talking about before, there are a lot of stakeholders who are really committed to this, who have suicide prevention as one of their top priorities. And then there are some firearms enthusiasts that are scared of this and that don't think it's something that they want to be involved with. And I really wish that we could reach them. And I think we're making a lot of strides towards that, and we're getting there over time. But in terms of the people that I hope we can reach out to. It's really those who are too concerned about what this kind of partnership might mean and maybe cautious and don't want to get into it. And I think, the more these efforts go on, kind of the more chance we have of making those connections. But that would be my hope.
Absolutely. We're talking about diversity and really kind of forming this broad coalition. And Gabby, if I could stick with you for another question. We've touched on this a little bit also, just like the trusted messenger and who's deemed credible. I think doctors Craig Bryan and Mike Anestis put out a paper last year that showed when you break it down, we know the veteran community is not monolithic. So if you were to look at Black male veterans in particular, they see the NRA as very credible and trustworthy organization. But if you look at Black women veterans, it's the exact opposite. Celebrities, I think, were top of the list for not being credible. But it fluctuated. So, research has shown that there are unique risk factors and motivations for women and other subpopulations within the veteran community. So could you tell us, has there been efforts to develop tailored, bespoke messaging to these individuals? And if so, what does that look like?
Yeah, I think this is a really important topic because, like Derek, like you were mentioning, these conversations have to be tailored and they have to be appropriate to the person that they're, partnering with. We're describing all of these amazing efforts, but it's important to contextualize them and say that there hasn't been uh, like a ton of research in this area. And so this is really just starting to be developed. We know a little bit about the effectiveness of lethal means counseling and what makes it more acceptable, but not a lot just overall and for specific subpopulations. And we have a lot of work to do in that area. There's been some really interesting work over the last few years. One person who comes to mind is Lindsay Monteith, who works in the Rocky Mountain MIREC, who's written a lot about women veterans and about having conversations about firearms with women veterans. And she makes a few points that are really important to think about. So one is that a lot of women veterans carry firearms because of previous trauma that they may have experienced, safety and security concerns that they have, interpersonal violence, other violence, and that really needs to be addressed in these conversations, that they need to be trauma informed, and need to address other ways of women feeling secure so that they, can, maybe rely on other methods aside from only firearms to kind of feel like they're in a safe spot. Another thing that's come up in these conversations is that women veterans sometimes own firearms, and then sometimes they themselves don't own firearms, but they're in a household where they have access to firearms. So that makes these conversations kind of complicated. It's one thing if you can decide what kind of access you have, and it's another thing if there's somebody else who needs to be involved in those conversations as well. And being careful, given that sometimes these relationships are contentious and things like that. So just, this one population that we're talking about, women veterans, there are so many different things to consider in these conversations. And the latest 2024 Veteran Suicide Prevention Report mentions some other subpopulations that are of particular interest when it comes to firearm suicide that have higher rates overall. So individuals like justice involved veterans, veterans who are unhoused, American Indian, Alaska Native veterans. So, quite a number of populations of veterans who we may need to think a little bit more carefully about and try to tailor some of this messaging to.
Absolutely. Thank you so much for that. Dr. Lemle, I have another question for you, but anything you'd like to add on that?
No, that was just a great answer.
I agree. So my good friend Joe Hunt, I think a lot of folks in the audience are familiar with him. He's a Vietnam veteran himself, and director of the New York Outdoor RX Coalition. He told me this story about his days working in advertising in a previous life, where they ran a whole bunch of ads in magazines encouraging men to have their prostates examined, and it flopped. It didn't do well at all. It kind of didn't work. So they went back to the drawing board and put similar ads in magazines that women read, encouraging them to have their husbands have their prostates examined, and it worked infinitely better. So I'm wondering how important, is involving family members and friends as well in this work, and have we seen anything similar in the veteran community targeting them to, provide assistance to veterans?
I would say yes and no.
Okay.
Um, Gabby was just talking about worried about a veteran, and I think that was put in the chat if I was tracking that. And let me just say that from my perspective, that's as good as anything that is out there on the internet. If an individual really wants to look at resources about friends and family that you're worried about, what do you do? What do you say? And so forth. Let me just give a shout out. I know you guys funded it. So kudos to you because it's just great work. The NSSF also has a smaller version called Have a Brave Conversation. These are some resources that might be readily available for an individual who feels like they just don't know quite enough in terms of how to approach something. Um, but back to your question, of course, peers and family are very important. I mean, how could they not be? They've got credibility usually, they've got influence usually, and you want to leverage that influence and credibility to help reduce firearm access as a precaution. Um, as Gabby was alluding to, healthcare providers sometimes do, sometimes don't have that kind of credibility. So when family and friends can step in, and usually there's just a lot more proximity to be able to kind of step up and do that. So of course they are. Gabby was talking in general for professionals, but really the same is true for individuals, that you want to think about this in a collaborative decision-making way. You wouldn't want to come in with a family member in a rather unilateral dictating, this is what you have to do. Any conversations about changing access is going to have to be a collaborative decision that really takes into account what's important with the individual. So that's a piece where I don't know the study you were referring to in terms of prostate exams, but that's a key piece regardless, is that even if it's going to be initiated by a family or friend member, and usually it has to be approached in this kind of bilateral collaborative way if you want to have any impact. And then, we've been talking in and around in terms of two very different pathways in terms of reducing access. One of which is how it's reduced in home. So, and the other, of course, is out-of-home storage. If we go back to the New Hampshire Firearm Safety Coalition and the Gunshot Project that we talked about maybe 20 minutes ago, there was a material that was developed right off the bat, terms being called the 11th Commandment of firearm safety. And they're talking about temporary, voluntary, offsite storage. That is going to give the most amount of time and distance between an intense surging impulse to end one's life and the ability then to access. So, if the goal in all of this is to create that kind of time and distance, out of home is the safest. We have 7% of gun owners who have said in a national survey that they've done that. From my perspective, that's a great start. And that's something that we want to grow. But in the meantime, we're looking for kind of a willingness, even within the home, to create more time and distance.
Thank you so much for that. And Gabby, I think you brought up a lot of good points. One in particular, the idea that you don't have to be the firearm owner, but if you're in a house that is you're privy to a lot of these issues. Same question for you. How important would you say is including family members and friends in suicide prevention efforts?
Yeah, so I think that's it's really critical. And you know, I think what we hear pretty consistently from patients and veterans in particular and family members is that they always wish they were more involved in these conversations and in treatment than they feel like they are. And so some of these efforts have been, like Worried About a Veteran, the Firearm Safety for Suicide Prevention workshop have been tailored towards family members because having collaborative discussions is particularly hard with our family members, right? As we all know. And so like providing training on how to go about that is really critical. One other thing I'll mention because it was put in the chat, but something that comes up a lot is transferring firearms and like legal issues surrounding that. And so that's like one thing that we talk about in the workshop. It's the thing that comes up most often when we have these conversations. especially because if somebody wants to, a family or friend wants to hold on to somebody's firearms, the questions sort of come up about how to make that happen. And so I wanted to call out some initiatives that have been taking place in certain states like Louisiana and others, where there are efforts to make the transfer of firearms less problematic in situations of higher risk. And there are other possible solutions like transferring a part of the firearm and not the whole firearm in a way that's legal. So these are kind of like the thorny questions that come up when we have these conversations. Um, and in terms of facilitating out of home storage, which is super important, there have been also a lot of efforts, Galatru in Louisiana and Emmy Betts in Colorado on getting together coalitions of gun shop owners to provide them information on how to be a resource for out-of-home storage and the legal intricacies of making that happen and making sure that everybody has the information and the access to resources that they need to be able to offer that service to their communities. And so it's sort of a multi-sided issue that is being approached from all sides.
Yeah, thank you so much for that. And Emily in the chat, thank you for your comments. Definitely want to hear more about that and I appreciate your input there. We are running a little low on time, so we're going to kind of pivot to a little bit of a lightning round now. But Gabby, we'll stick with you. We talked about this, VA International report each year on veteran suicide has what they call anchors of hope, some bright spots, because we know this, it's not a lot of great news. Is there anything giving you hope currently about this work?
Yeah, one thing that I think has been really incredible that Russell has mentioned is just the strikingly lower rates of suicide among veterans who are involved in VHA, and VA's efforts for distributing cable locks and now even lock boxes for educating clinicians and for bringing it out into the community as well. So their efforts now with the community engagement and partnerships coordinators to develop coalitions with local firearm experts. So to me, that research and those initiatives are a real bright spot, in terms of how to continue to approach this issue.
Absolutely. Dr. Lemle, anything giving you hope these days?
I find all of this hopeful. I mean, in this time of seemingly increased polarization, which is how you started this entire dialogue, I find there's great hope in expanding common ground and collaboration that we continue to see. I mean, year by year, month by month, this is continuing to grow. I find it incredibly hopeful.
Absolutely. And thank you so much for that. And sticking with you, is there anything, or if there's one thing that the audience could leave today knowing, what would you want that to be?
Always we come back to the notion that suicide is preventable. I was talking much earlier about the kind of common misconception that there's an inevitability for an individual who reaches a point in their life when it feels like suicide is the only option. But that is really not the case. And to not be afraid to ask. You cannot put the idea in someone's head around suicide by asking a question. And in fact, just the opposite. I mean, you're going to want to demonstrate that you have interest, concern, and you can save a life.
Absolutely. Thank you. Gabby, same for you. One takeaway for the audience to leave knowing?
Yeah, sometimes stories are really memorable, and I just wanted to share a story that we were just let known about last week about a VA provider in New York who is a community engagement and partnership coordinator who provided information to gun shop owners about suicide prevention and was able to save a life. So someone came in and looked like they might be in need and was provided with the Veterans Crisis Line and got treatment instead of purchasing that firearm. And so, these efforts have real impacts. And hearing that just makes some of the effort feel worthwhile. So.
Absolutely. Also, is there anything, we touch on a few of these things, but anything to keep an eye out for as far as legislation, campaigns, training, future events, anything to highlight for folks?
You want me to jump in, Gabby?
Sure.
I mentioned earlier that next Tuesday, there's going to be an unprecedented bill being brought up in the House Veterans Affairs Committee. That's Chris Deluzio who's a Democrat from the 17th District of Pennsylvania, who's the author of that. It's the first of its kind, has to do with firearm suicide prevention. There's another bill that I don't think is quite ready for hearings, but it's from Clay Higgins, who's a Republican in Louisiana, who's taken the Armory project that Gabby talked earlier about in terms of Louisiana and Gallatrue, in terms of the work of the VA is collaborating with local gun shop retailers for out-of-home storage. It's a fabulous program, and the Higgins bill is trying to spread that in a pilot across 5 different regions, and then ultimately nationally potentially. It's very innovative, and that's in the pipeline. The Gun Storage Check Week has only gone through its first year last year. It's going to be coming up again in June. Please keep an eye out for that. That is a way that we're kind of spreading across the firearm industry interest in the ways in which firearms are routinely locked as part of their secure storage. And I'll also mention that this coming May, the NSSF at their annual Leadership Marketing Summit, which is something they do every year, where they have hundreds of individuals who are kind of key figures inside firearm industry in their annual meeting, is going to be devoting a half day just to firearm suicide prevention. So all these coming down the pike pretty quickly.
Excellent. Thank you so much. Gabby, anything else you wanted to add?
No, that's a great list. There's also some new efforts. New York State now requires suicide prevention programming in their pistol permit classes, and so there are efforts kind of to develop that programming as well. And so, yeah, all of these are things to really look forward to.
Awesome. And last one for you both, Gabby, we'll stick with you. You get a magic wand, you could change one thing to help prevent veteran suicide. What would that be?
That would definitely be getting the information out about this misconception of the VA or any other healthcare provider sort of tracking or, confiscating firearms. I think if we got rid of that misconception, we would have a much easier time with a lot of these efforts. So that would be my choice.
Excellent. Dr. Lemle, yourself?
I agree. That would have been my answer as well. It would be monumental as we get that misconception corrected in the veteran community.
Absolutely. Appreciate that. And so we're running a little low on time, but Dr. Lemle, I would mention this to you. There was so much, and certainly over the years, Gabby, that I've learned from you both. And we didn't get to, touch on a lot. So hopefully we can bring you back and do a deeper dive into some of these questions. Since a lot of this stuff is new, a lot of this is new to folks' ears, and we're kind of digesting and processing at the same time. But we are going to have to wrap things up here. But Dr. Lemle, Dr. Kazanoff, I truly can't thank you enough for joining us today and for the incredible work that you do. Thoroughly enjoyed this conversation, despite the heavy topic. Would love to keep it going, but hope everyone in the audience found the discussion as insightful and informative as I have. We did just barely scratch the surface again. So for more information, I can't recommend folks in the audience checking out the resources we linked to in the comments and following the work of our guests. I'd like to quickly give a shout out to my colleague Shannon on our communications team for all the behind the scenes work to make this happen. It's truly appreciated. And if you're still on Twitter, be sure to give us a follow at NYH Foundation, myself at Classic Decoy. Also sign up for our e-newsletter on our website if you haven't already for more details about future events and other updates. Thanks again to our amazing guests for the incredible conversation, and thank you all again for joining. I hope everyone enjoys the rest of their day.
Thanks so much, Derek.
Thanks, Derek.